What leadership qualities do you perceive to be most important to be an effective charge nurse leader?
Communication. I think communication is very important. Everyone needs to know what's happening and be able to communicate effectively so that we're all on the same page.
I would have to say communication.
You need to lead by example, so don't ask your staff to do something that you would not be able to do yourself.
Organization. Listening. Communication.
I think having a positive attitude, and that creates the karma for the floor.
Follow through and communication.
Approachability. I think approachability is very important for the patient as well as for the staff.
Making sure my patients and my nurses are well taken care of and that they are safe.
To work well with your team.
In my department pre-op, I would say managing the flow of the patients, just because timing is ever changing and very important to keep the rooms on time.
Communication and teamwork and competency, experience, compassion.
Listening skills, the ability to listen to somebody when they have a problem.
Communication.
I think being organized.
Definitely to be responsive when your staff comes to talk to you and to give them suggestions on what you would do with the patient, and also be available with any kind of updates that they need with their patients, and to talk to their doctors and to give them updates also, and just trying to be a responsive charge nurse and attentive.
I think one of the most important qualities is assessing your environment, working with your team, and developing a plan.
And at the same time, charge nurse leaders confront a multitude of challenges. In your frontline leadership role, can you please name a challenge that you face?
A challenge that I face is when everything is thrown at me all at once, and you need to know how to prioritize and deal with everything.
Mediating between the family members and the care team.
Probably how to distribute the workload when we're faced with staffing challenges to make it fair.
Conflict resolution. Dealing with different characters.
I think it's juggling multiple issues at once. When anyone comes to me with a problem, it is now my problem, and sometimes I have multiple problems to solve at one time.
Staffing ratios and making sure that my nurses are able to adequately care for their patients.
Time management. Having to take several different roles.
Service recovery with families of patients that aren't doing so well. Sometimes that can be a challenge.
Trying to do too many jobs at once. We don't have a secretary, so I'm covering secretary. I'm trying to do the charge nurse job. I have a patient. You're getting pulled in too many different directions.
Get the new staff to understand how and feel comfortable to educate the patient and the family, therefore resulting in happier patients.
As the charge nurse, we are not only in charge, but we also take assignments. So doing all that on top of, very importantly, we have to do everything quickly, accurately, efficiently.
Because it's such a busy unit, just trying to manage patients coming out of the OR, and we also take patients from other areas like endoscopy and IR and MRI, so just trying to time manage all of that.
Communication.
For me, it's when I have multiple patients, I'm the secretary and the staff needs assistance, so I feel like I'm pulled in a lot of directions.
Challenge is that you can't be in all the rooms at one time, and if you have multiple things to do at one time, you have to prioritize, and that's the hardest thing, is not to be able to go to every single room when you're exactly needed, but go where the most need is.
This challenge was being able to resource for all of the staff on the floor. As a charge, you are being pulled in 5 to 10 different directions, and making sure that you're available for the new nurses as well as the experienced nurses would probably be the biggest challenge that you face as a charge nurse.